welcome to this educational forum of IVF and fertility. In today's episode, we'll be considering the effect of adenomyosis on IVF. And the question that should have been asked will have been, does adenomyosis affect IVF? I first of all want to tell you what adenomyosis is. Adenomyosis is also a kind of benign growth in the walls of the uterus or in the body of the uterus. It's a growth of the uterine lining into the walls of the body of the uterus. And a woman having adenomyosis occasionally will have very enlarged uterus, and occasionally it could be confused with fibroid. But ultrasound can distinguish it, and of course the conclusive diagnosis is histology. But the problem with ultrasound is that as against fibroid, adenomyosis is poorly defined, but then it grows very large and resembles fibroid on ultrasonography. Adenomyosis compromises the architecture of the uterus, and when adenomyosis infiltrates the junctional layer, which is the layer just between the uterine lining and the walls, the myometrium, which is the wall of the uterus, it compromises the chance of implantation of a transferred or transplanted embryo. So in this case, adenomyosis could compromise implantation and cause recurrent pregnancy losses or recurrent failure of implantation. And how would you make a diagnosis whether adenomyosis is affecting the junctional layer or not? A diagnosis of this could be made using a 3D, three-dimensional ultrasound scan. And with a three-dimensional ultrasound scan, you can actually see a wave of infiltration from the myometrium onto the endometrial lining. That's an indication of adenomyosis that could have affected, that may affect implantation. So that's the way adenomyosis affects implantation, cause recurrent implantation failure or even early miscarriages. And in the event that pregnancy occurs, in gross cases of adenomyosis, there could be late miscarriages. And when pregnancies are taken to term and delivery occurs, there may also be a problem of uncontrolled uterine bleeding, a case where we refer to as postpartum hemorrhage, and this can actually be a very huge complication following delivery of the baby. But what are the solutions in dealing with adenomyosis? A woman can have a long period of downregulation before IVF treatment is done, and the situation where adenomyosis is so gross and compromise ultrasound visualization of the ovaries, a debulking procedure of the adenomyosis could be embarked upon. This is a surgery before the commencement of IVF treatment. A special kind of surgery that is done actually for adenomyosis is called a coring kind of surgery, where the bulk of adenomyosis from the wall of the uterus surrounding the endometrial lining, the lining of the womb, is cut off so that a woman has an increased chance of carrying pregnancy. But in gross cases where all these things have been put in place, surgeries have been done, the long-term period of downregulation was embarked upon, and still you fall back with having recurrent pregnancy losses or failure of implantation, we could consider surrogacy, a situation where the eggs are gotten from this woman in question, fertilized with her partner's sperms, and transferred onto another woman's womb that has agreed to bear the pregnancies for the couple. That's what we call gestational surrogacy. It's done in a lot of parts of the world today, and there are other countries that have legislations against them. But that could be a solution to managing adenomyosis. Adenomyosis, of course, affects IVF outcome. For more information, you could visit ABS Hospitals and Diagnostics in Rayfield, Jos, Nigeria, or rather visit our website at www.abshospital.com, or even contact us through any of our social media outcomes as displayed on your screen. Until I come your way, next time. I'm Kenneth Eguda, consultant gynecologist and your IVF specialist. Thank you for listening.